about 10-15 minutes after the Hello and good afternoon, everyone. Thank you for joining us today. My name is Hugo Rodriguez, and I'm a member of the Levy Senior Center Foundation. And we are happy to welcome you to today's Levy Longevity Program on patient education, advocating for your health, presented by Dr. Jonathan Max. This longevity series is presented in conjunction with AMITA Health in the city of Evanston. And in these sessions, common issues of concern for adults 55 and older will be discussed so we can learn ways to live well and age gracefully. As always, we appreciate your support of the foundation as we continue to work to connect our community of older adults. I'd like to now turn things over to our wonderful moderator and partner in organizing these programs from AMITA, Michelle Neisner. Michelle?
Thank you, Hugo. My name is Michelle Neisner, and I am an athletic trainer by trade and the sports medicine liaison in the Northwest region with AMITA Health. I'm going to start off by going over some housekeeping items. First, all attendees are muted for the duration of the presentation. Questions may be submitted using the Q&A feature in the bottom center of your screen. Please do not use the raised hand or chat feature or attempt to unmute. We will not be able to hear or see you. Next, at registration, you were able to pre-submit questions. Similar questions were grouped together and addressed in this presentation. Additional questions will be answered at the end of the presentation during the Q&A portion. Additionally, it is not permitted for this presentation to be recorded by attendees. However, it is being recorded and it will be available on the Levy Foundation YouTube channel and website. Lastly, this presentation is intended for information purposes only and is not intended to replace individualized care provided by your respective doctors and or practitioners. AMITA Health and the Levy Foundation are not liable for the misuse of any information presented today. Now, I would like to introduce you to our speaker. Dr. Jonathan Max is back with us today. He is the Regional Medical Officer for AMITA Health Medical Group and specializes in internal medicine as well as geriatric medicine. Today, he will be providing information to help you get the most out of your healthcare visits. Welcome back, Dr. Max. I now turn it over to you.
Thank you, Michelle. Thank you, Hugo. It's great to see everyone again and welcome all of my participants. I hope that we'll have a really exciting discussion today. I'm thrilled to be back with the Levy Center Foundation, and thank you for the invitation. I'm going to get started with our discussion, and we're going to talk today about how to be a champion for your health or for someone you love. Here's a short blurb about me, though. I'm a lifelong Chicagoan. I specialize in both internal medicine and geriatric medicine, as Michelle mentioned earlier. I spent several years living in the Evanston area, although I grew up in the city of Chicago. Currently, I wear a couple different hats. I work in an office in an outpatient clinic as a primary care physician. I also do a lot of administrative work on behalf of AMITA Health and AMITA Health Medical Group as the regional medical officer for our medical group. I like to show a brief outline of what we're going to cover today because you'll see a theme throughout our discussion. The theme is preparation and organization. In order to be a champion for your health or for someone else's health, we're going to start by just discussing what a champion is. And I think it's important to lay that foundation of how we will approach our care when we see a healthcare provider in the office. Secondly, we'll talk about preparation for those visits, followed by ways in which I think all of us can figure out what's important to ourselves with respect to our health. We'll cover some aspects, some key aspects about that office encounter, and then follow that with some ideas about next steps to keep your health going in the right way. Lastly, we'll wrap up with Q&A, questions and answers, through our moderator, Michelle. So first off, why would I bring up the idea of champions? Okay, I think because when we talk about champions, we talk about how to put our best feet forward. We talk about commitment. Now, there are some well-known champions here in the Chicagoland area. I will not comment on how our professional teams are doing right now, but we can think about our World Series champions, the Chicago Cubs, and we'll think about the Bears in the 1980s as examples of individuals who came together as a team, individuals who took responsibility, individuals who worked together and brought great relationships together to be successful. So if we think about the word champion, let's think about a definition for a champion. Here's a definition from the Merriam-Webster dictionary that I accessed online last week. And one definition of champion is to be a person who actively supports or favors a cause. Actively supports or favors a cause. And I think if you use that frame of mind for your office visit with your doctor, you'll be in a better place. Now let's think about some synonyms for champion. I underlined a few words there that come to mind for me as a physician when I think about a champion, and I think about becoming a champion for one's own health or for those that you love. A friend, a proponent, a protagonist, someone who supports. Also words that are related to the term champion. So stalwart, interpreter, encourager, or a fellow traveler. I think all these words in front of you, especially those underlined words, will really, really highlight what I think folks could do to help advocate for their health in the doctor's office. So you'll hear this theme again as we move forth through the discussion today. But now for the second part of our presentation, how do we prepare for those office visits? How do we prepare for them? Because I think preparation is really, really important. And as a person who grew up in Illinois, let's look to one of our more famous Illinoisans named Abraham Lincoln. And here's a really neat quotation from President Lincoln. "Give me 6 hours to chop down a tree, and I will spend the first 4 sharpening the axe." I will spend the first 4 sharpening the axe. I think this statement from President Lincoln says a lot about what preparation means and why preparation is important for us as we see our doctor. So in front of you is a molecule, and this is a molecule of penicillin. So penicillin is, to me, one of the great modern miracles of medicine. Penicillin was discovered in the early 1900s, so the last century. And at that time, it took several high-tech companies to work together here in the States and overseas to recognize the potential for penicillin, to bring together learnings, and to make something really, really incredible. Penicillin was the first antibiotic that was developed. And after the development of penicillin as a medicine, many different pharmaceutical companies exploded with new types of medicines that vastly changed the healthcare landscape up until the current day. Some of those companies that helped develop penicillin and the early antibiotics are companies that you might have heard of before. Pfizer, Merck, GlaxoSmithKline. It was really amazing that those companies still stand strong today as we move through new healthcare crises. In addition to the development of penicillin because of its potential, World War II really spurred and pushed the development faster and faster so that governments worked with private industry to move product. There were a lot of challenges though at that time. Initially, companies did not want to collaborate together, but after different teams overcame some of that reluctance and worked together, we found some new avenues to take care of the entire world. Now, when we use that story and bring it to our topic today of going to the doctor's visit, it's really important that we recognize how confusing healthcare can be. Educating yourself and preparing are ways in which we can reduce some of that stress, some of that uncertainty as to meeting the doctor. And that preparation can also improve the likelihood of getting as much as possible out of that doctor's visit and getting a better outcome. I mean, I think there's nothing more disappointing than going to the doctor's office, not necessarily knowing what to do and not being prepared, and then walking away from that doctor's visit saying to yourself, gosh, what did I really do there? And what did that all mean? By preparing, will reduce those chances. So growing up in Chicagoland, I remember driving with my parents to a store called Simms, and many of you probably remember the store. Unfortunately, it was a great department store that went bankrupt several years ago. But I really like their kind of call to action, if you want to name it that. So an educated consumer is our best customer. Our educated consumer is our best customer. So I like you to all think about that as another way in which we prepare for the doctor's visit. Dr. Karen Joint is a physician cardiologist, as well as a public health researcher from Harvard, who writes a lot, including some blogs regarding population health and public health issues, especially in vulnerable populations. And here's a quote from Dr. Joint that I think's germane to today's conversation. The medical system is complex and can be overwhelming. In order to get the best possible outcomes, it really helps to be an active consumer. So I think that really speaks to what we're trying to do today. Now, another aspect of preparing for a doctor's visit is to understand how a doctor's visit is a relationship. It's a complex relationship, and just like any other relationships in life, there are a lot of nuances to those relationships. So here's a image from Cirque du Soleil. I think that's how you pronounce it. I took German in high school. I didn't take French. You know, one of those shows that I think many of us have attended, and my wife and I have brought our 4 kids to a couple of shows here in Chicagoland, and are always loads and loads of fun. And I'm showing this slide here because I think as we prepare for that doctor's visit, we want to recognize the different relationships and perspectives that go into taking care of someone's health. There are certainly perspectives from the patient, from the individual, but there are also many more perspectives that we have to take into account. We have to take into account family perspectives, the primary care physicians or the physician's perspective, specialists' perspectives, And then we need to consider all of these viewpoints along every step of the process as we address our care. Because if we don't do this, I think we could be selling ourselves short. So also, if we do this, these are opportunities to provide a great championship type of experience. So let's move on and talk to some of the basics for going into the doctor's visit and preparing, okay? I like to call this a planning list, okay? And this is something, and we'll talk about in a few minutes, that I think is a great idea to prepare beforehand and bring with you throughout the whole process of your healthcare encounter. The first thing on a list that you'd like to have is a simple sub-list of your healthcare team members. So that includes people like your primary care provider. The primary care provider is really, really important because that person you should view as your quarterback or your go-to person, your main individual in healthcare to help you through any healthcare issues, any medical issues you have. Including on that list would be your specialists, let's say a neurologist, a cardiologist, a surgeon or two. It's nice to include therapists on that list as well. So folks who are part of that healthcare team that can address, certain aspects of medical issues from time to time. The fourth member of that healthcare team is actually your pharmacy and your pharmacists, both the local pharmacists as well as mail order. Because as we go through addressing your health and being champions and promoting good health, we have to make sure that all these things are aligned. Secondly, having an accurate medication list is really, really important. Now, I'd like to take a step back for a second and talk about medicines. Some of the biggest, the highest number of preventable healthcare crises or complications in medicine these days are actually medicines themselves. There is a term that we use in geriatrics frequently called polypharmacy. So polypharmacy is a term that refers to, quite simply, too many medicines. And that might involve, the wrong medicines. That might involve the incorrect dosing of medicines or frequency of medicines. That polypharmacy term includes things like over-the-counter medicines, in which there are preventable errors in healthcare that are a result of medicines. So it's really important to maintain an accurate medicine list. And if you're meeting a doctor for the first time, creating that list yourself with the name of the medicines, so both generic and or brand names, the pill size, and how they're administered. So when pill size refers to the dose, okay? For example, let's say I'm a patient with high blood pressure and I take a medicine called lisinopril, which is a blood pressure medicine. Lisinopril comes in, let's say, I want to say 7 different sizes: 2.5 milligrams, 5 milligrams, 10, 20, 40 milligrams, okay, and et cetera. I want to write down on my medication list that I'm taking a 10 milligram tablet of lisinopril. I have 10 milligram tablets, and I'm taking 1 tablet twice a day, including topical salves, including prescription over-the-counter eye drops, as well as inhalers, are things that many folks don't think of medicines until they're specifically asked, but can be medications nonetheless that can impact several different health issues and can interact with other medicines. Another overlooked aspect of medication lists are over-the-counter pills and supplements. Supplements are big, big business. Many over-the-counter medicines that are available today at the local pharmacies were initially prescription medicines. And so having those on your medication list will also be very, very important. Lastly, I'm calling out pain medicines. Many folks visit the doctor for pain issues, whether they're directly related to the office visit or a consequence of something else related to someone's health. It's important to include those pain medicines on that accurate medication list. I'm going to give you a little teaser that we're going to talk about something in a little bit called a priority list. And the priority list is going to include things like your medications and how medications interact with your active health issues. So here are some other basics though. Make sure you have a list of your allergies. Okay, and allergies can be reactions to medications, both prescription and over the counter, allergies to foods, as well as environmental allergies, like dog hair, molds, things of that sort. It's also helpful for your doctor to see what kinds of reactions or to understand what kinds of reactions they have for medicines. Many times what we consider allergies are really not allergies, but they're what in the medical world we call intolerances. For example, I am allergic to erythromycin and what are called macrolides. Those are a type of antibiotic. Many of you have heard of Zithromax. I'm allergic to Zithromax, and I develop hives if I take Zithromax. So that's something I'd write down as I prepare for my doctor's visit. I also have an intolerance to amoxicillin, which is a penicillin-based antibiotic. I can take amoxicillin if I take the medicine with a lot of food, but if I take amoxicillin on an empty stomach, I become very nauseated and I develop heartburn. So that nausea and heartburn is not an allergy, it's actually an intolerance. But I told my primary care doctor that I want you to put amoxicillin on my allergy list as an intolerance, simply because I don't want to have anything to do with stomach upset when I'm sick. Fortunately, there's so many other options for antibiotics these days and other medicines that allergies or intolerances to amoxicillin and to erythromycin are not issues. Okay, so that's an example of what's important for allergies. Number 4 on the basics list are point people for your health. Point people for your health. Now, this is also something that's very overlooked, but is really, really important if you want to be as stalwart as possible for your health or for your loved one's health. If you want to be a champion, if you want to pay attention to what's really, really needed at some point in time. POA refers to power of attorney. And there are 2 types of powers of attorney. There's a power of attorney for healthcare and a power of attorney for finance. These are the folks who will be your proxy if at any point you can't make decisions for yourself. Okay. Another point person for your health that's nice to include, not necessary, but nice to include, would be folks who you live with or folks who can be available for you, like, in a pinch. So, for example, if I'm a patient who has trouble with my vision and I can't drive right now, it's nice that my doctor, my primary care doctor, my ophthalmologist, or other doctors would know that my wife can be someone who's readily available to maybe take me to and from visits. She can be someone who can double check medications so that I'm taking the right medications, okay, at the right time in the right place, okay. Number 5 on this basics list is something called a POST form. Now, as I prepared for this discussion today, I debated with myself whether or not to include number 5 on here. As a primary care physician, I think POST forms are very, very important. And they're not controversial, but it's a really, really big topic. So I won't spend a lot of time on it. POST is an acronym that stands for Provider Orders for Life-Sustaining Treatment. Many of you might have heard of the old Do Not Resuscitate or DNR forms. This is a state of Illinois form that's derived from those old DNR forms. It's again, a state form. Every state has one of these, and they're very, very similar. But the state of Illinois has a post form that is a easy to read and easy to understand checklist of medical things that you want or don't want if you're in a bad situation. For example, if I were unfortunately in an auto accident and I'm in a coma, okay, and I arrive at the St. Francis emergency room and I need emergency surgery at St. Francis. My wife is my power of attorney for healthcare on my post form. And so the emergency room docs would contact my wife, Gretchen, and ask her if it's okay for surgery, because I wouldn't be able to say, yes, do surgery, or no, don't do surgery, okay? The post form has 3 big sections on there. It has a section regarding CPR and chest compressions, and whether those first line interventions are something you're interested in or not. The second section of a post form has to do with medical interventions. For example, putting a tube down the throat to breathe for you, giving you IV antibiotics or other IV medicines in an intensive care unit or hospital setting, but also covers things like if you just want comfort measures completely, and you don't want heroic measures, and you think to yourself, that's time to kind of take things to the next level, okay? The third section on the post form covers nutrition, medically administered nutrition. That's basically something like a feeding tube. If you want a feeding tube to keep you alive, or if you want a feeding tube for a limited period of time, or if you don't want a feeding tube at all. What's important in healthcare today is what's called the autonomy of the patient. So the ability of an individual to make these decisions for themselves. The post form is one way to do that and to be prepared, okay? Now, probably the most important prep tool for everyone here today is what I'm going to call the priority list, So the priority list is something that I developed as a derivative of something that's used in healthcare all the time, which is called a patient problem list. The problem list has a very specific definition, and I included the definition in front of you. This is according to Medicare or CMS, okay? Medicare defines the problem list as, quote, a list of current and active diagnoses as well as past diagnoses relevant to the current care of a patient. So let's break that down for a second, because understanding what a problem list is will bring you a long way to being a champion for your health, okay? A diagnosis is a term that refers to some sort of medical condition, and that can be a whole host of things. There are over 90,000 different medical diagnoses right now available in the world, okay? And that can be something like high blood pressure as a diagnosis. It could be diabetes. It could be multiple sclerosis. It could be Alzheimer's disease, anything, okay? But what's important here on the problem list is that we're referring not only to a diagnosis or diagnoses for plural, but we're talking about current and active diagnoses. So there are diagnoses that occurred at one time but are no longer relevant. For example, if I went into the St. Francis emergency room and had terrible abdominal pain and I had appendicitis would be on my current problem list. I would undergo surgery to remove that inflamed, infected appendix, and I would go home the following day and recover well. When I returned, or when I went to the surgeon's office for a follow-up visit, I would have appendicitis and appendectomy as 2 of my current diagnoses. But after I'm finished with the surgeon and I've fully recovered, the appendicitis diagnosis will be off my problem list. The appendectomy diagnosis will be off my problem list because they would no longer be current or active diagnoses. So the problem list is a key concept. It's used now in healthcare, especially with our electronic medical records or electronic health records, to communicate from one healthcare provider to another, from one computer system to another. It's a very, very important communication vehicle across the whole healthcare continuum. The problem list is meant to be updated on a regular basis and revised. New problems are added, resolved problems, like I used the example of the appendectomy or the appendicitis, are removed or replaced. We're going to use this format and this concept for ourselves as we prepare for the doctor's office. So the priority list. So here's a way to think of the priority list. Think about issues when you make a priority list for your health as you prepare for the doctor's office, issues that you find of value to yourself and others find of value for you. So again, as we spoke about earlier, the idea of relationships and perspectives. Think about what's important for you, but also what others may think are important for you, okay? And so switching out that problem list concept, okay, that the doctors use and nurses and hospitals use to a priority list. So just substituting those terms. This is something that you'll carry with you as you go from, let's say, one doctor's visit to a next, or you go from one specialist to another. Okay, this is something that's very personal because it's created by you and it's about you. It's created by you and it's about you. Both you and your doctors and healthcare staff will update this list and revise it. And you can do this together as a team, adding new priorities, removing resolved priorities, and replacing some others. So I like this idea. And I think this is one of the things that if there's anything you take away from today's discussion, think about a priority list. Dr. Max wants me to make a priority list. So let's look at an example of a priority list. What would it look like for someone as you prepare for a doctor's visit? On this screen, I wrote down two lists of issues, health issues for the same person. On the left-hand side of the screen, you see what the medical record might read for a problem list. Hypertensive heart disease, diabetic nephropathy, cerebrovascular disease, venous stasis, laryngoesophageal reflux. Now, those are mouthfuls of words and terms and tough to pronounce for many folks. But if we translate them into a priority list for the patient, and this is what I'd have you do. Number one, your priority is dizziness. Number two, healthy eating. Number three, repeating questions too often, the same questions. Number four, leg pains when my legs get swollen. Or number five on your priority list, trouble singing at church, trouble singing in the shower. So in front of you is an example of the problem list in the medical record, and then something that you could develop for yourself. Now, those two lists kind of map together in many ways and are very, very similar, but they're different. The biggest way in which they're different is the fact that the priority list is in your words and is described by you for you. Now, I'd like to give you another example of priority lists and some items that would be meaningful or worthwhile to add to that priority list of yours, okay? Allow me to live at home for as long as possible. Reduce my medications. I do not want to be hospitalized. I'm definitely willing to try anything and everything, whether it's approved or experimental, if it's a treatment that can help me live longer. I just want to attend my granddaughter's wedding next year. That's a big priority to me. I prefer a good quality of life over prolonging my life just for the sake of prolonging it. These are examples, real world examples of priorities from my patients in the office that I'm sharing with you today as things that you could place on your priority list as you prepare for that doctor's visit and as you prepare to be a champion for your own health. So bottom line, think about what's important to you. Think about what's important to you. So now we're on our third section of today's agenda. And I have this little graphic here for you. So a young lady, looks like she's doing some crosswords and things of that sort. And I want to get back to that theme from earlier about perspectives and relationships. Here's a quote: "We do not see things as they are. We see things as we are. We see things as we are." So again, another example, another way of saying that we have to take many different things into account. Okay. Another way of thinking about this is thinking about that holistic approach to care that many of you maybe have considered or have embraced in the past, or maybe never even heard of. The idea of looking at an individual from stem to stern, from top to bottom, from inside to out. Okay. Think about different perspectives as you prepare for that doctor's visit, as you prepare your priority list. Think about those relationships. Now, we are here to talk about you after all, but again, let's look into other perspectives. So here's one example. Here's a kind of a neat cartoon. This is a cartoon from a leadership seminar that I participated in one time that identified the whole point here is to think about perspectives. Okay, so here we have two different people having a different view of the same picture. So the inmate on the left of the screen looked out that window and all that he saw are metal bars. Now the inmate on the right-hand side was a little happier. He has his sunglasses on because he's cool and relaxed. And he seems more upbeat. He seems like he's thinking about other things. So when he looks at the window, he doesn't see the restriction of the bars like his roommate there. What he sees is the outside world. He sees the house and the trees and the hills and the sky. You know, this is just a representation of what we're trying to get at, of perspective. So when we think about perspective, I want you to know a closely guarded secret in healthcare. We need your help. Doctors, nurses, therapists, hospitals, healthcare systems, we need your help because unfortunately, our perceptions of you are not always accurate. They're different. So there are many studies in the medical literature looking at what I call an incomplete understanding of patients' needs and patient preferences. So this cuts across many facets of a patient's healthcare experience, from the hospital setting to a pharmacy setting, to a physical therapy setting, behavioral health setting, and definitely the doctor's office. There is some variation from one specialty to another and from one health system to another, but the point here is that healthcare needs you to help us understand you. And again, that's where the priority list is going to come in, by telling your doctor and your teams what's important to you. Okay. Fortunately, there has been a shift in healthcare over the past 10 years or so, 10 to 15 years, of developing what's called a patient-centered approach to care. So here's one example of that discrepancy and that lack of understanding. There was an article published in an anesthesia journal about 3 years ago that was entitled "Defining Quality of Recovery: What is Important to Patients?" And the researchers in this article asked what patient priorities are for successful recovery from surgery. Anesthesiologists are the doctors and support staff who help keep the body in good shape as you go undergo surgery, whether that's putting you in twilight for something like a colonoscopy, or putting you under spinal anesthesia for a hip replacement surgery, or putting you under general anesthesia to remove your gallbladder. Those are anesthesiologists, okay? So in this study, both hospitals and clinicians rated 3 things as really, really important for patients, what they viewed it as important for patients. Helping prevent nausea, they felt was really important. They felt helping manage pain and controlling pain was really important. They also felt that patients just want to avoid complications after their surgery. Well, guess what? These 3 things were the least important for patients. They found them important, but not nearly as important as other things. Guess what patients found important? They found, the researchers found that effective communication is important. So communicating with themselves as the patients, as well as their family members and friends. Okay, those healthcare proxies, those power of attorney for healthcare. Patients found in this study that allowing them to be actively involved in their healthcare decisions was really, really important, especially when it comes to surgery. The third highly rated aspect of that healthcare experience for patients in the study was to have empathy from their healthcare providers, empathy from the physicians and from the nursing staff, empathy from the patient care technicians and from the medical assistants. Those were the things that patients found important in the study. Now, I'm sharing this study with you because it's but one study of many, and it's a good example, a very straightforward example of why it's important to set up those priority lists for you before you go into the doctor's office, okay, and as you prepare. So another way of looking at this is to say that everyone sees something different. Okay, on the top you see red or orange, and that's the healthcare perspective. On the right-hand side in green, you can see the family perspective, and then there's also a cultural perspective. But in the middle, as a composite of all these things, the patient perspective, your perspective. So I want to again highlight this as a key feature for taking charge of your health and being a champion for yourself or for those loved ones as you move forward into healthcare encounters. So now something that's also important when we talk about a priority list is that the priority list is active and it's living, and it changes like anything else that's alive, okay? So your priority list needs to change. What you have on that list as, the top 5 versus the bottom 5 will change over time. And as in that little cartoon there, depending upon what's going on, you might say that your health means something different from 1 month to the next or from 1 year to the next. Here are a couple quotes from patients when they sent to me their priorities. One patient said to me, this type of thing is important because I want to enjoy reading. Another statement, another quote, I would rather live with some discomfort than to take pills with so many side effects. A third example is this quote that says, we want to resume road trips because this unpredictability just makes life too erratic. So you can imagine some where these things come in the context. The context of the reading could be a patient who has vision issues, and rather than undergoing more radiation treatments for a skin cancer on the scalp, which will destroy the vision, that patient would rather have some other alternative treatment for that skin cancer, so that the patient can maintain the vision and enjoy reading. Okay. The road trip quote refers to a patient who had trouble with bladder control and wanted to do as much as possible to control that bladder so that he can go on road trips again with his wife and grandkids. These are important things. Physicians and healthcare specialists might not think of these things as priorities for an individual until that person brings that out to the patient. Now let's move on to the fourth section on our agenda list for today, the meeting, the doctor's visit. But before we do that, let's recap what we've discussed so far. We've talked about the concept of being a champion and embracing and supporting the cause of good health, of being encouraging, of being a fellow passenger or fellow traveler, of becoming stalwart to maintaining that protagonist approach for health. We talked about preparing and organizing many aspects of your health. The idea of organizing things for you so that when you do meet the doctor or doctors, you'll have everything prepared. The concept of creating a priority list is something we've covered. And that priority list will reflect active health-related issues for you and those preferences that are highest importance for you and perhaps your family. The fourth concept that we covered thus far is this idea that different perspectives exist. And you have to make sure that you can share your preferences with others. So here he is again, one of our fellow Illinoisans. There's Honest Abe, okay? And let's talk again about planning. So Abe came back, President Lincoln came back to us. And when we talk about priority lists, you might think to yourself, good grief, I can list 500,000 things on my priority list that are of importance to me, that are key for my health. Well, that's phenomenal, but you're not going to be able to address all 500,000 items on that list at that doctor's visit. So try to look at the list and identify 2 or 3 things that you like to be the focus of that particular visit. 2 or 3 things. Now, how do you decide what's going to be important on that? Where are those 2 or 3 things going to be? Well, think about any previous encounters, whether, doctor's visits, therapy visits, hospitalizations. Think about those previous encounters and use those to help frame the 2 or 3 things that you're going to focus on at the current visit, the upcoming visit. Think about experiences you've had. Think about recent events. Use all those things as reference points for that current visit. I think another aspect to planning will be the idea of that family participation. As we age, okay, or even as you remain young, when you have health issues, sometimes it's hard to grasp the big picture, and it's hard to stay keen on what's happening and what's not happening. And sometimes we get sidetracked with other types of health issues. So it's important to have a second set of eyes and ears, people who are your go-to folks. This isn't necessary, but I think this is something to keep in mind. Sometimes patients will have family members who insist on being a part of the equation, and you'd prefer to say, you know what, why don't you stay at home? I'll give you a call afterwards. And that's okay too. But most importantly, it's important to be forthright at your doctor's visit, at your healthcare visit, and to be honest with yourself. It's normal to be a little stressed and anxious about these encounters, but try to relax. And I think as you prepare for these encounters, you will be more relaxed as you get these things organized. So you'll be able to go through these things in your head. So let's get back to this idea of the patient-physician experience. The patient-physician experience is definitely a relationship. Now, I have some ideas that I'd like to challenge all of you with. And these ideas come from a different vantage point. The vantage point of thinking about you as a whole person. The vantage point of making sure that you are as actively engaged as possible in your health or in your loved one's health, okay? So it's traditional to share preferences for your care, and you're gonna do that. You're gonna do that through your priority list. But I also think that you should take the time, ask your doctor what his or her preferences are for you. Secondly, you're gonna walk into that encounter and that doctor's visit with expectations. I hope that my doctor gives me an answer to why my hand continues to shake so much. I'm worried that I have Parkinson's disease. I'm worried that I had a stroke. So that's what I'm expecting to learn from the doctor, okay? In the same manner though, I think it's useful to ask the doctor what he or she expects out of you. What does the doctor expect out of you? The doctors always take notes on the computer, make sure you're taking notes too, whether you bring your laptop with, or you take notes on your Samsung device, or maybe you do the old-fashioned thing and you take notes like I do right here. Take some notes. Now, your doctor is also going to ask you questions to help better understand what's going on, and that's part of the normal operating procedures. Think about asking questions of your doctor as well. So before you wrap up that office visit, you should ask questions. Getting back to that Sims slide. So Sims department store, an educated consumer is our best customer. You're going to be better educated. You're going to be a better customer. You'll be a better patient if you are able to ask questions so that you can understand what's going on with you and what the doctor is sharing with you. So another way to think of this is to reframe things. Reframe things. Okay. So I would call this a not to miss hack. A not to miss hack. So a hack is a term that refers, it's a colloquial term that refers to a solution. Many times an on-the-fly solution, a spur-of-the-moment solution, something that's not necessarily ground in stone, but it's something that you come up with. This is a not to miss hack. Reframe things, okay? Reframe things. So now it's important to understand, though, at least from my vantage point, and I think many doctors will agree with this, that a good physician, a good healthcare professional will summarize the highlights of your encounter, both in person and on paper. In person and on paper. Make sure that happens. Make sure that your second set of eyes and ears who are with you has a chance to ask some questions. It's not just you asking questions. Give some feedback to that clinician, to that doctor. Give a summary. So reframe it in your own words and ask the doctor, did I correctly summarize or recap the plan that we're going to pursue? Also ask another question. And this is another way to reframe the conversation in a doctor's visit. Hey, doc, are there any other options that we didn't explore yet? What else is there? Lastly, offer this scenario. Say, hey, doc, if you were in my shoes, how would you decide to handle this? What would you do? Now, some doctors are going to ignore that question because we get those questions frequently. And I'll tell you another secret in healthcare. I think many healthcare professionals, both doctors and nurses, love this question, this scenario, but many of them also dread it because it's human nature that a lot of folks don't want to be put on the spot. They don't want to be asked that question. But I'll tell you this, I think it's an important question to ask. Hold that doctor's feet to the fire and say, hey, you know what, if you had to walk in my shoes, is this what you do? If yes, why? If no, why not? Okay. And many times a thoughtful doctor will bring your priority list into that response and say, well, for me, I would take option A, but because of your priorities and your preferences, I think option B is a great decision for us to make as a team. So here's another clever cartoon, okay? As we go through that actual doctor's visit. Here's another clever cartoon. And this is interesting because they have these two people, one on an island, another one in a boat, and they're both praying and desperate to be rescued. The man stuck on the island has been waiting for a boat to come by and save him. The man in the boat is just hoping for some, to say, land ho, and to see terra firma once again. When that guy in the boat lands, though, he's definitely happy to get out of the boat. And this is just another example. The moral to this cartoon is that two people in the same situation can view things very, very differently. Okay. And I want to encourage and remind that point that perspective is really, really important. I think to get as much possible out of that doctor's visit, you have to share your perspective of what you want and ask the doctor what he or she thinks is important. And really, you should understand their perspective as well. So let's look at some next steps. Okay. So again, as we recap what we've covered so far, we've talked about champions. We've talked about preparing for the doctor's visits. We've talked about figuring out ways in which you have to understand what's important for you. We talked about that actual office encounter, that meeting with the doctor, and bringing some things to that encounter, okay? So more than just thinking about, I'm gonna talk about my heart disease. What is it about that heart disease that's important to you? Why is it important to you? Bring those things and bring that perspective so that the healthcare team can understand you in a better way, okay? But it's also important to think about next steps. I have a saying in the office all the time, that things are easy to understand, but hard to remember. Easy to understand, but hard to remember. And I use that as an example of why it's really, really important to get what's called an after visit summary, okay, before you leave the office. And I'll submit another concept to all of you today. Have an extra copy for that go-to person, okay? It just makes things easier so that your go-to person can also understand what's going on. Because having a written, concise game plan that includes the tests to be done, that includes medicines to continue or to stop or to change, a game plan that has a list of changes that are gonna occur, a game plan that has lifestyle updates, a game plan that has referral information, okay, and also a game plan that has recommendations for follow-up visits. These are things that are easy to understand as you go through them, but can be very hard to remember because your brain's spinning and you're just trying to digest all that information. So have something visual for you, something that you can hold on to, I think is going to be super, super important. I hope all of you receive after visit summaries each and every time you see your doctors or you go on some sort of healthcare visit. Because if you don't, I really want you to ask for that next time or demand it. Just say, hey, this is all great, doc, but I'm going to get into my car and I'm going to forget half of this stuff. And we know from psychology research that people do forget things pretty quickly, okay? Especially when they're out of their kind of realm, their comfort zone, when these things have a very strong emotional impact, when people aren't their best. When you're at your best, great, you could probably remember all of these things. But chances are when you're at the doctor's visit, you're not going to necessarily be at your best. So that's why having that extra after visit summary for your go-to person and having the after visit summary just for you will be really, really important here. So I want you to think about moving forward after that office visit, moving forward one step at a time. I like the idea of debriefing with family and friends. So those people who are important to you, people whose opinions matter to you, who will give you a fair shake. Okay, trying to do that as soon as possible while everything's fresh in your mind. It's important as part of your next steps to think about a second opinion. Now, what's a second opinion? What does that mean? That means that there are many situations in which an individual will see a specialist, let's say a cardiologist, or even better yet, let's talk about an oncologist, a cancer specialist. Okay, you see one cancer specialist for recommendations about how to treat your condition. Okay, that's certainly that oncologist will give you a number of recommendations, but maybe an oncologist from a different system will give you an entirely different set, or maybe the same set of recommendations. That second set of recommendations is a second opinion. Any physician who's worth his or her salt will not mind a second opinion. Do not feel guilty. Do not feel ashamed. Do not feel upset that you're insulting someone or you're being gauche because you want to get a second opinion. Again, any physician who's worth his or her salt won't mind a second opinion. If that physician does mind a second opinion, I don't know if that physician's worth seeing anymore, to be honest with you. Now, another important point about next steps is invariably many people run short on time in the doctor's visit, okay? Some of you sent in questions beforehand for today's discussion, okay? Q&A questions. And 3 of those questions were actually about this very topic. Dr. Max, if I don't have the chance to address all my questions and stuff, what do I do? Well, I don't like that. How do I handle it? Well, that's why you're going to have a priority list, and you're going to highlight 2 or 3 things that you want to cover. That's why you want to think about another appointment. So your last question of that encounter should always be this. Okay, doc, when do we see each other again? What are the next steps that we're going to take together? And to that point, you want to book your next doctor's appointment before you return home. Book that next appointment. Strike while the iron's hot. Get that underway so that you can keep moving forward with your health. Now we're going to wrap up here with your after visit summary with Dr. Max. And there's a bunch of things that we covered. So it's a 2-part summary. Okay, this is page 1 of 2. After we finish this after visit summary, then we'll move on to Q&A. So number one on here, think like a champion. So actively support your cause. Remember those terms we used, synonyms or associated terms for a champion, as ways in which you get in the right frame of mind for your doctor's visits. Secondly, create that priority list, similar to that problem list that I and my peers use in healthcare all the time. Create a priority list in your own words that covers practical considerations, but also can cover some of those big ticket items. Next, figure out what's going to be important to you, whether it's in the grand scheme of things or what's important to you for that particular office visit, and highlight 2 or 3 things for every visit. Okay, highlight 2 or 3 things. Next, remember that the office visit is a relationship and it should feel that way. Challenge your doctor with questions. Doctor, what would you do in my situation? What would your wife do? What would your mother do? What would you do for your son in this situation? That's a way to be actively engaged. That's a way to be a protagonist and a champion for your health. That two-way relationship. Don't assume anyone or everyone understands you. So again, sharing your thoughts and your preferences and your ideas with the healthcare team, with your primary care physician, with your specialists, because that will give those folks more information and a better ability to take care of you the way that you want to be cared for. Okay. It's also really, really key to make sure that those go-to people have that understanding as well. Because just like the healthcare professionals, those go-to people, your family members and friends, have their own biases and their own perspectives that come into play here. And we're talking about you. We're championing your health. Make sure you get that after visit summary, or also known as a written summary, at every single encounter. These things are easy to understand, but hard to remember. So you're going to have that with you. Before you leave that doctor's office, make sure you take a couple minutes to not only digest the conversation and that encounter, but also reframe it and verbalize it to that doctor. Say, hey doc, so I want to make sure I know what you're saying to me. Let me reframe it for myself. You mean that we should pursue option B instead of option A because of my preferences on my priority list. Is that right? If you can reframe it, you own it and you've got it. Lastly, always make sure you identify next steps. Make sure you identify some next steps that will keep you on that straight and narrow path so that you can get the most out of your health, so that you can be a champion for yourself and for those you love, so that you can be the best advocate as possible. You can be the best protagonist, the best supporter, you can be the best fellow traveler for that healthcare journey. So we're going to wrap up now and move to a Q&A section. Please send questions through, not through the chat, but through the, I think it's just called the question section, question and answer section. Before we do that though with Michelle, I do want to give a special shout out to the folks who made today possible. The Levy Senior Center Foundation, the Levy Center's leadership team, AMITA St. Francis Hospital, and then as you see on the graphic there, on the photo, all those heroes and champions in healthcare, because there are many, many places where heroes work. And I think we have to give a shout out to those folks who take care of us each and every day, despite all the challenges we face. Okay, Michelle.
All right, here we go for the questions. Can you provide good ideas or prompts to get men who say, I am fine, to the doctor and reluctantly discuss symptoms to doctor? but are clearly in distress at home?
Oh boy, oh boy, oh boy. You're putting me on the spot there, Michelle. Well, thank you for participant number one who shared that question. I'm a guy, okay, so I'll admit that guys are sometimes, clueless. I don't know what you want to say, or maybe not in tune, or maybe reluctant to share their feelings. I think that's where a problem list can be very useful, and planning beforehand, so that when you're at the doctor's office and the doctor says, "So, Mr. Smith, how are you doing?" And Mr. Smith replies, "I'm fine." Well, you can point to that problem list, and an astute doctor will say, "Well, Mr. Smith, you tell me you're fine. That's wonderful. However, here on your list, you mentioned that you feel dizzy frequently and you have very little appetite. It sounds like that's unlike you. In the past, Mr. Smith, we always talked about new restaurants in Evanston and in Rogers Park. And we talked about those new restaurants in Wicker Park that you enjoy. And you always give me tips on restaurants. So tell me more about this, Mr. Smith. I know you feel fine right now, but it sounds like things aren't the same."
Okay, I always struggle to answer specific questions like, how long have you had these symptoms? How do I best prepare or anticipate these questions?
And another great comment, Michelle. Thanks for that one too. So in medical school, physicians are trained to interview people, okay? And those interview skills involve what we call open-ended questions. So as opposed to asking a closed-ended question, like, for example, saying, are you in pain? That's a yes/no question. Rather, asking the question, so how do you feel? What is it like to recover from surgery? Those are open-ended questions that might be tough to answer. I would reply that you want to be as honest as possible, and it's okay to say, I don't know. I don't know. If you reply to that question, I don't know, then the physician will come back with other types of questions or other ways to get at the meat of the matter. So it's okay to say I don't know, but most importantly, just be honest, Michelle. Just be honest.
Okay. I have several specialists as my doctors. How can I get them to work together to come up with a plan for my whole person?
That question speaks to some of the conversation we had earlier, Michelle, about the holistic approach, or just looking at people from stem to stern, from top to bottom, to look at that individual. Many times specialists are phenomenal experts for their parts of the world, the kidneys or the heart or the bones, but become so fixated on those areas of expertise that those folks, those specialists, lose sight of the rest of the individual and that individual as a whole. That's where the primary care doctor oftentimes comes in, where a good primary care physician will look at an individual as Tom Smith, as Rebecca, as Gretchen, and not just a person with diabetes or a person with a stroke. So the priority list will also help out with that. And that priority list will help bring some continuity from one specialist to another. One of the huge advantages to the electronic medical records like Epic or Athena or Cerner, one big advantage of those computerized records is that things can be sent electronically or by fax or even snail mail very easily so that folks can communicate. When you have that preparation list with your healthcare team, with your primary care doc and your specialists, you will make it very easy for your doctors to share information with those folks, obviously with your permission, But by having that list available and updated, you will have the opportunity for your doctors to share that information and bring that continuity. So between the priority list and electronic medical records, you'll be able to conquer that challenge.
All right, next question. Why do so many doctors insist upon putting their older patients on the testing merry-go-round? It seems that they want their patients' primary activity is to run around to various testing facilities. Yet the effects of the merry-go-round are lingering and debilitated, even though they find that nothing comes of these tests.
Good grief, Michelle. This sounds like a situation in which there's not that good communication between the physician and the patient, as we talked about earlier. It sounds like this is a situation in which that relationship isn't necessarily a two-way relationship. It sounds like this is a situation in which the patient's priorities maybe aren't realized by the healthcare physician. And if the physician does realize or hear those priorities, maybe that physician is not listening and needs a reminder. This is another opportunity for the priority list that's written up in your own words to say, I don't want to have a bunch of tests just for the sake of doing tests, or to say, I only want tests that will have a meaningful result that will mean something for my care. I don't want to have tests and run around from this hospital, that hospital, this diagnostic place to that diagnostic place just because we can do them. I only want to do things that will improve my quality of life, or I only want to do things that will help preserve my vision. That's where the priority list comes into play, Michelle, and that's where that planning comes into play. So that, if you understand what's important to you and share that with your healthcare team, you'll be much better off, much better off.
Okay, if different doctors provide conflicting information, where do you go?
Good question. We kind of answer that question, or I guess I alluded to answering that question of yours, Michelle, when we spoke about second opinions and next steps. There certainly is conflicting information many times because healthcare and medicine is not black and white, it's not cut and dry. There are a lot of gray areas, and that's where someone's preferences might come into play, preferences to do something or not do something. That's where a second opinion can give you a different set of eyes and ears and a different perspective. That's also the opportunity for that primary care physician. Sometimes I call that primary care physician your quarterback for health or your conductor for health. So Michelle, I have 4 kids and they're all teenagers. And so I've had the pleasure of sitting through, pre-COVID of course, sitting through many plays and musicals and concerts. And when you sit through concerts, that concerts sound great when all the kids are listening to that conductor and paying attention to the conductor, okay? In the same manner, like let's say in football, and you have a football team and there's the quarterback. A good football team is going to have all 11 players pay attention to the quarterback. And that quarterback's going to know where everyone has been in the past. A good quarterback is going to know where everyone is right now. And a good quarterback's going to know where everyone's going to, so that the team can work in sync. Having your primary care doctor as that quarterback will allow you to come to terms or reconcile that conflicting information so that you can feel comfortable with where you are, where you had been, and where you're going to for your health.
If you're not currently on any medication and you're going to visit a physician for the first time, should you let them know what vitamins you are taking?
Great question, Michelle, and thank you, listener /participant for that question. medications that are over the counter, supplements, vitamins, are all part of that same that same network as we talked about before when we plan for that doctor's visit. Write down those things. So write down those supplements that you're buying, write down those vitamins. Even if they seem inconsequential for you, they can be really, really important. I'll give you a quick example of how this can be life-saving for someone's health, Michelle. So when I was in medical school at Northwestern, I remember that Northwestern University Medical School came up with this new concept of rounding in the hospital with what's called a multidisciplinary team. So the concept was such that the physicians and the medical students like myself at the time, as well as nurses and pharmacists and physical therapy, occupational therapy staff, all rounded together every day to talk about patients. And we went up and down each and every ward, each and every aisle and section of the hospital to talk about those patients. There was one patient I distinctly remember, a younger woman who was in her mid-40s, who kept coming into the hospital time and time again with severe kidney infections, something called pyelonephritis. And no one could figure out why this woman kept coming back to the hospital with the same problem again and again and again. This, Michelle, was a condition that that could be addressed with antibiotics and cured, and then totally resolved and off the problem list. It was the pharmacist who asked the question during rounds, hey, what other medicines does this patient take? And so, of course, we looked at the paper chart at the time, because that was before computers in the hospital. And like, well, the patient took the antibiotics when they left the hospital, and then took the blood pressure medicine. And the pharmacist was really, really sharp and said, "Are you sure that's it?" And so we went to the bedside and we talked to that patient, Michelle. And guess what? The pharmacist asked the question, "Well, do you, when you go to the store, are there any vitamins and stuff?" It's like, "Oh, of course, I take a ton of vitamins. I take this and take that and take this and that." And guess what? The vitamins were blocking the ability of the antibiotics to work outside the hospital. So the patient didn't take those vitamins in the hospital, and the antibiotics were IV. But when the patient left and took oral antibiotics, the antibiotics didn't work because no one took the time to ask or thought about asking, "Hey, what about vitamins?" So to answer your question, Michelle, it's really, really important to mention those vitamins at that doctor's visit.
Can you provide access online to those forms that you developed?
Sure. In terms of the stuff that I have that I shared with you today, I believe all that stuff can be available. None of this is copyrighted. This is all, me, myself, and I. These are things that I share with my patients. And I'm sharing with all of you here today. I believe, Michelle, that everything is also available through the foundation's website, correct? And as well as on YouTube, I believe, in the near future. So, yep, absolutely.
How much time do you get for a normal office visit?
So speaking of time, we're almost out of time, Michelle, I think. The time for an office visit varies from clinician to clinician, varies from day to day. Many specialists or doctors, I should say, in general, will bake in more time for that initial visit because there's a lot of unknowns and the patient and the physician are trying to get to know each other. So that tends to be a longer visit. Subsequent visits tend to be shorter, but it really, really varies. A new patient visit could be as little as 15 or 20 minutes, or as long as an hour to an hour and a half, depending upon the situation in the case. I would also say this, Michelle, to answer our participants' question here. There might be something to ask beforehand as you schedule a visit, and ask the staff, "Hey, for Dr. Smith, how long is that visit for a new patient appointment? Will it be longer or shorter? Are there things that the doctor doesn't want to cover, or there are things that the doctor does want to cover at that initial visit? And can I go ahead and already set up a follow-up appointment, right after my initial visit or not? There might be an opportunity to bring up that idea of follow-up visits to cover next steps, but also cover things that you might not get to at that first visit.
I have done most of the things you suggest, but I still leave the doctor's office dissatisfied. I am sorely tempted to look for a new doctor. Is it better to stay with a generic primary care person or seek out a doctor who focuses on geriatrics?
That's another great question, Michelle. Now, I'm a little bit biased, because I have training in geriatrics, but I don't only do geriatrics. The things that I learned in geriatrics in terms of successful aging, to me, go for the whole continuum of life. Whether you're 25 or 45 or 85, I think there's a lot that we can do to keep ourselves healthy. And there are a lot of philosophical things and approaches that can make someone's health better. Okay. Many specialists, geriatric specialists, take this approach. Many primary care or generalists also take this approach, but it's really across the board. I think that if you're dissatisfied with your current physician, one option for you would be to share your thoughts and your perceptions at an office visit, and sit down with the doctor and say, well, this and that. There might be a dyssynchrony, okay, between how your doctor views you and thinks about you compared to what you see as your own health and your priorities. So writing those things down as a priority list beforehand and bringing that to the doctor's visit would be a great thing to do. Now, another approach though, and second option would be to maybe seek out a different doctor, and instead of committing to a new doctor per se, committing fully to that doctor, maybe setting up an appointment to have an interview and make sure it's a two-way interview. You go in there and say, I like to see if we're a good fit. I like to ask some questions about you, and I love for you to ask some questions about me. And Dr. Smith, here's my priority list of what I think is important for my health. That would be a great second option, a great alternative to sitting down with that primary care doc with whom you're not satisfied. But I think it's reasonable to do either approach, Michelle. I don't want to encourage people to leave their doctors if they're not satisfied, because many times those things can be reconciled very quickly and easily. And the first step there involves communication and talking to that doctor face to face.
All right, I think we might have time for one more question. What is the best way to navigate and get coordinated care between two different entities? When one has doctors in each of the places, so like two different health systems?
So that's another great question, Michelle, and I bet many of our viewers today have that same question. Is here in Chicagoland, we have several different healthcare systems, and there are excellent physicians and excellent care specialists in every single system, and sometimes patients will go to one system to another based upon those specialists and those needs, and that's okay. That's okay. What's important there is to make sure that you bring the list of your healthcare team, that list, to each of these encounters. When you see one doctor in system A and another doctor in system B, you tell both doctors, hey, can you make sure you communicate with the other doctor so that they know what's happening and they're all on the same page. In the same way, I always encourage my patients to make sure that they tell all their specialists, send a report to Dr. Max, or if there's some other concern that you have about my health when you see me, call Dr. Max, contact him so that the two of you can hash things out for me. Okay. Those are some of the things that you can do. I think the communication across healthcare systems is much better now, Michelle, than it had been in the past. There's always room for improvement, but things are much, much better. So whether it's electronically, by snail mail, or by fax, and yes, doctors' offices still use fax machines, unlike the rest of the world. We still use faxes. There are a lot of opportunities, but it's great that you remind your doctor. But again, a good doctor will automatically do that for you and should say so. Should say, hey, I'm going to communicate with so-and-so. I'm going to send your test results to that person and this person. But it doesn't hurt to mention it.
Thank you all for attending today. I hope you found the presentation informative and helpful. Please be on the lookout for the follow-up email that will include a recap and information on additional resources, as well as a feedback survey. Thanks again, and we look forward to seeing you at the next Levy Longevity Series presented by AMITA Health.
Bye, Michelle. Bye, Hugo. Bye, everyone. Take care and stay safe.